Hi, I'm Antonio Mora. FDR said the only thing to fear is fear itself. But the truth is, we'd live very short lives without a healthy dose of it. Fear can paralyze, but it can also spur us into making crucial decisions necessary for survival. That applies to not just you and me in our regular lives, but to politicians and health officials in the decisions they make that affect us. In the context of the coronavirus epidemic, it's the cautious optimism and lack of fear expressed initially by everyone, from the leadership of the World Health Organization to President Trump, that led to a response to the outbreak that wasn't as aggressive as it should have been. As soon as we learned about a month ago that the virus was easily transmissible by air, that it survived on surfaces, and that people who were asymptomatic could spread the disease, you'd think we would have seen a robust and urgent international response. But no, even though the virus had already spread to a series of Asian countries and Australia, the WHO took weeks to declare a global health emergency and has yet to declare it a pandemic, even though there are now cases on every continent but Antarctica. Making matters worse, because the enormous majority of the cases and the data on mortality come from China, the international community was forced to rely on China's authoritarian regime for much of what's known about COVID-19. It's not clear the data provided by the Chinese is complete or accurate. Chinese secrecy, hostility to dissent, its initial cover-up of the outbreak and underreporting of cases, and the downplaying of human-to-human transmission fueled the problem. Then, China took weeks to allow a senior WHO team, including Americans, to travel there. By the time the Chinese imposed the largest quarantine in world history and started cooperating with international officials, it was too late to stop the spread. The most it could do was slow it down. Now, it will be the ability of Western democracies to address the challenge of an outbreak that is likely to be tested. The transparency, openness, and cooperation among governments and private companies and institutions that exists in those democracies should help. However, some tougher measures may be more difficult to impose in places like the US, where we are loath to restrict individual liberties. That said, the president has extensive emergency powers that could be invoked in a national health crisis if need be. Even so, political polarization in the US shows we have reason to worry. Trump's early dismissive comments about the threat the virus could pose were embarrassing, contradicting the message coming from his own health authorities. He finally seemed to mostly get on the same page with them when he addressed the nation in a news conference and put Vice President Mike Pence in charge of the administration's effort to combat the threat. But Trump has little moral authority on the topic because he has slashed funding for government programs that deal with domestic and global disease outbreaks. He also seems to want to downplay the threat, in part for political reasons. And Democrats aren't helping. Instead of working with the administration and health officials to figure out the funding needed to combat the virus, they instead slammed Trump's plans, came out with their own, and generally seemed to see this as a way to play politics and hurt Trump. Some of the same people who criticized the administration's early moves to address the crisis by shutting down travel between China and the US are now criticizing the White House for not moving faster. The intellectual dishonesty is astounding. There's no question that we should fear this virus. Harvard epidemiologist Mark Lipsitch estimates that 40 to 70% of the human population could potentially be infected if we see a COVID-19 pandemic. However, many wouldn't get sick, and most who did wouldn't have serious symptoms, no more than a very bad cold. Still, those percentages are frightening. In a worst-case scenario, if 70% of Americans were infected and the mortality rate were the estimated 2%, something that I should say is not yet a hard number, almost 5 million Americans could die. That's more than all the people who live inside the city limits of Los Angeles. Again, that seems to be the extreme worst-case scenario and depends on a lot of ifs actually happening. Even though the director of the CDC has warned that it's likely this virus will be with us for the foreseeable future, it could fizzle out during the summer. Already, the growth in cases in China is dropping, although it's rising elsewhere. A healthy dose of fear could help arrest the disease by making all of us take preventive measures when they're needed. Other institutional efforts to control its spread could put the brakes on the number of people getting infected. We will soon know if an antiviral drug is an effective therapy, and if it is, that could make the disease far less scary. Finally, a vaccine could also be available in about a year. Fear, however, is a serious issue when it comes to the economy. Trying to contain the virus by shutting down factories has disrupted supply chains. The virus is slamming the travel industry. Economic activity in China, the world's second largest economy, has slowed, and some of the most dire forecasts indicate that China could soon have a negative GDP. Paraphrasing the old saying, when China sneezes, the whole world catches a cold, an especially appropriate saying in the face of this outbreak. Weakness in the Chinese economy will increase the risk of a global recession. U.S. stocks have seen their worst few days since the Great Recession, and that could lead to a sharp decline in American consumer spending, an important motor of world economic activity, and a possible recession here. As Health and Human Services Secretary Alex Azar said, panic can be as big of an enemy as the virus. What leaders need to do now is navigate the narrow lane between panic and the healthy fear that will prod us to take the actions needed to defeat the virus without severely disrupting American life.